The Women's Caucus for putting this on today, and thank you all for attending. We had 200 RSVPs, so people are probably trying to get out of work. And so to our candidates, if there's a little shuffling, please don't get disturbed. People are coming and going today, so thank you very much. I'm the California State Assembly Majority Leader and Chair of the Legislative Women's Caucus. I want to welcome our Gubernatorial Forum on Women's Economic Security, Health, and Safety. So I want to thank you, our candidates, our panelists, and everyone in the room for showing up to be part of this important conversation. You know, women, we drive the economy. We hold our communities together, and we care for our families. So when women are doing well, our whole state is stronger. The topics we're going to talk about today are economic insecurity, health disparities, and gender-based violence. These aren't ideas on paper, they're real-life issues. So for millions of women and families across our state, every single day they worry about these issues. We're looking forward to a thoughtful, honest conversation today about leadership, accountability, and the real solutions Californians are counting on. Now, it is my pleasure to introduce our moderator, Daniela Pardo, who will guide today's discussion. Daniela is a former Spectrum News reporter who now serves as the Public Affairs Director for Senate President Pro Tem Monique Limon. Daniela, thank you so much for being here, and now you're in charge.
Thank you, Majority Leader, and thank you to all of you for being here today and for the Women's Caucus, and of course our candidates. Go ahead and come onto the stage. Thank you all for taking and making the time to be here in Sacramento with all of us. I know we're all looking forward to hearing more from all of you on these very important topics that we're here to discuss tonight. So, with that, we'll go ahead and get started. As Majority Leader mentioned, we're going to go ahead and focus on economic security, health, and safety. Each of the candidates are going to have a couple minutes to answer each question, and then we're also going to have an opportunity for members of the audience to ask their questions at the end. I'm going to go ahead and introduce everyone in alphabetical order from their last names. And then again, just a reminder for you guys, 2 minutes so we can get to that Q&A. And if you guys need me to repeat the questions at any point, I'm happy to do so. And we'll go ahead and get started. All right. To my right, I have former Secretary Xavier Becerra, who has spent decades serving Californians at both the state and national levels, most recently as U.S. Secretary of Health and Human Services. Prior to that, as Attorney General of California, he was a leading advocate for healthcare access, social justice, and consumer protections, taking on major legal battles to defend vulnerable communities and uphold workers' rights. With more than 2 decades in Congress and statewide office, Becerra has championed efforts to expand economic opportunity and address systemic inequities. He is known for his deep policy expertise and collaborative leadership style. He brings a commitment to equity and opportunity for all Californians, emphasizing pragmatic solutions to the state's most pressing challenges. Next up. That's right, thank you, Mr. Calderon. And with that, we have Ian Calderon. He is a former Assembly Majority Leader. A lot of you know him from that. He has built a reputation as a pragmatic, collaborative legislator known for negotiating results and earning respect across party lines. In the Assembly, he helped author and pass California's landmark film tax credit program, keeping thousands of middle-class entertainment jobs in the state and generating billions in economic activity. He has also fought for his community, securing millions in state funding, including the reopening of the Whittier Courthouse, restoring access to justice, and revitalizing the local economy. Ian believes California can once again be the best place to raise a family, build a home, and raise a future. His campaign for governor is focused on practical solutions, making California affordable, expanding childcare access, lowering the cost of living, and making government more accountable and transparent. Mayor Mahan. He is the current mayor of San Jose. He has worked to modernize city government, implement technology-driven solutions, and promote fiscal responsibility. Mayor Mahan has spearheaded initiatives to improve public service, streamline city operations, and increase government accountability, often leveraging technology to make local government more efficient and transparent. Known for a results-oriented approach, Mahan brings a municipal perspective to statewide challenges, emphasizing innovation, civic engagement, and policies that directly improve the quality of life for residents. His leadership style prioritizes practical solutions and measurable outcomes, blending progressive ideas with effective governance. Now we have California Superintendent of Public Instruction, Tony Thurmond. He's devoted his career to expanding educational opportunities and promoting equity for all students. He has worked to close achievement gaps, support under-resourced schools, and ensure that families have access to the resources needed to help children succeed. Thurmond emphasizes policies that strengthen schools, support teachers, and address the social and emotional well-being of students. With a deep understanding of the education system and a commitment to fairness, he advocates for initiatives that prepare California's children to thrive in a rapidly changing world. And last, but certainly not least, we have Ms. Betty Yee. She is a former California State Controller who has extensive experience overseeing the state's finances and ensuring accountability in government. She has championed fiscal responsibility, transparency, and efficiency in managing public resources while advocating for programs that support working families and reduce economic inequality. Yee has a long record of leadership in budget oversight, state audits, and financial reporting, demonstrating a commitment to responsible governance. Her work reflects a focus on fairness, equity, and practical solutions that safeguard the state's resources while promoting the well-being of all Californians. All right, here we go. Is everyone ready? Okay. First question, I'm going to start with you, Mr. Becerra, and then we'll take turns with each candidate going first. But the first question is, childcare in California is often as expensive as rent or college. The providers who make up this workforce are overwhelmingly women and disproportionately women of color. They do the job while oftentimes earning poverty wages. By the way, I know this firsthand. My mom has been a childcare provider for more than 20 years. But as governor, what specific steps would you take to make childcare affordable, raise wages for providers, and ensure long-term stable funding?
First, thank you for the question, and to the Women's Legislative Caucus, thank you for convening us and letting us address you, because we'll be working, one of us will be working with you as the next governor, and we have to be ready to launch as quickly as possible. I will tell you this, it's unfortunate to have a situation where we treat a worker who cares for our children or cares for our elderly as someone who deserves less than the minimum wage. But that's the truth about it. I remember how expensive it was to get health access to childcare, because I was one of those latchkey kids, as we called them way back then. My three sisters and I, my parents could not afford to provide us with childcare. So when we get home from school, we knew, don't play with the stove, stay away from the windows, and wait for us to come home. And you knew that you had to stay safe. It's unfortunate that we're going back to those days and we have learned very little. So here's what I would do as governor. First and foremost, we will pay decent wages. We want people who do childcare to understand that we want them to consider this a career, not just a temporary place until they go find a job flipping burgers that pays them more. We want to make sure that they understand that this is childcare that has to serve not just adults who are in the workforce. We have students in college who have kids who need to know that there's childcare available for them so they can finish their undergraduate studies. We have people who work 24/7 who need childcare. We need to make sure we're providing access to childcare in some of these facilities so they know they can make sure that they can work and all their money in overtime doesn't go to pay childcare. And so we can do all these things. I can tell you we'll do them because I did them as Secretary of Health and Human Services. I passed a rule under Head Start, which is in HHS, that would have increased salaries for Head Start teachers by $10,000 because the Head Start programs couldn't keep their teachers because they were paying them so low that they could really go make more money flipping burgers. I went out and we established a program that would help families that were trying to figure out how to get that daycare available to them. And so we will move quickly.
Thank you, Mr. Becerra. Mr. Calderon, would you like me to repeat the question? It won't count towards your time.
Childcare.
Okay, you got it.
Well, again, thank you to the Women's Caucus for having me. It's great to see so many of you again and some of my former colleagues. This issue is absolutely paramount and important to me, mainly because I have 4 little kids and I am still a dad, and I have a wife in need of childcare. When we had all 4 of our kids in childcare, we were spending more in our childcare payments a month than we were in our actual rent. When our second daughter, Hartley, was born, my wife had to make a really uncomfortable decision. Do I continue to work, which is something that she loved doing, and something, at one point in time in her life, she never knew if she was going to have kids because she wanted to have a career, and that was important to her. And she ended up stopping working, giving up her career so that she could be with the kids full time during my tenure while I was in the legislature, and the significant demands that took on her and her time, and the lack of being able to feel like you're doing anything that, is beyond just caring for your own kids. Not that that's not important, but that she was taken out of that workforce, and how important that was for her to be able to still have that and not have access to that. Childcare is extremely important. We have to expand access. Childcare should be treated as infrastructure in the state of California. Just like we need roads to drive on in order to get to work, we have to be able to have infrastructure for childcare, so parents can feel confident that they have a place where their kids can go, where they're going to be safe, they're going to get access to resources that they need, and we can continue to keep moms and we can continue to keep parents in the workforce. That is so important. We cannot have a functioning economy and a functioning state without having access to affordable childcare. I'm going to cap childcare costs at $500 a month for 95% of the kids in this state, 0 to 5. My budget will be a budget of a statement of my values. I am going to fund it, because everything that this governor is funding now doesn't mean that's what I'm going to fund. And I'm going to work with all of you, because you need a governor that you can work with and that you can count on and understands the legislative process to be able to get this done. And I know working together, we can get that done and have a workforce that is treated right with dignity and respect, so we know our kids are getting the best amount of care and access to that care every single day.
Thank you, Mr. Calderon. Mr. Mahan, you're up next.
Thank you. Well, thank you to the Women's Caucus for having us today for this important conversation. I'm excited to have... Did I lose my mic? Can you hear me? No? There we go. All right, we'll share. There we go. Thanks for bringing us together for this conversation. Yeah, exactly. Collaborative. Look, I'm grateful for my mother-in-law, who spends half the year with us and makes it possible for Sylvia and I to both have fulfilling careers. It's created incredible opportunity for our family. Not every family has that privilege. And I also know that when we have paid for childcare when our kids were younger, it was like a second mortgage. It was incredibly financially stressful, and we're pretty lucky. We both work and make reasonably good money. If we're serious about gender equity, we have to expand access to childcare. And I think there are 3 main levers we have with a lot of smaller solutions within each one. One is to expand the supply of childcare providers. In San Jose, we're looking at how we leverage our streamlined permitting, real estate services, training, capacity building to get more local entrepreneurs into the childcare economy and equip them to expand options for people and keep costs down. Number 2 is smart subsidies, building on the work you all are already doing to expand subsidized slots, tax credits, and find ways to make it affordable for working families. The third, though, that in the long run is really important as well, is I've talked about getting back to basics. That's what my campaign is about. And when we make it easier to build housing and increase the supply of housing, bring down the cost of housing, have more options for people, remove barriers to building condos and ADUs, we allow multi-generational families to live closer to one another. And that is another solution for many families that relieves pressure. And far too many of our families are forced to live far from each other because they can't afford housing. So we have to get at more fundamental structural issues in our economy if we're going to expand opportunity for families, because these things are all connected. Thank you.
Thank you, Mr. Mahan. Mr. Thurmond, you're up next.
Thank you. Good evening, everyone. Thank you to the Legislative Women's Caucus for hosting tonight. It is also great to see some former colleagues. And as you all know, when I was in the Assembly, I chaired the Budget Subcommittee on Health and Human Services, and we used that committee to steadily increase rates for reimbursement for our subsidized child care program. We certainly still have a ways to go. This is becoming a trend.
Uh-oh.
And we'll make sure we have good microphones when I'm the governor. We have a ways to go as we continue to improve, funding to both subsidized childcare and all childcare programs. It is hard to believe. My daughters today are 19 and 23. When my daughters were born, childcare cost more than college tuition, and it still costs more than college tuition by today's standards. And when my daughters were born, I had the good fortune with each of them to actually take some time off and stay home with them while we were looking to balance and find childcare programs. We have to do better with our current childcare providers. They cannot stay in business because they're not being paid well. When the owners of our childcare companies boil down what their rate is, they're essentially being paid minimum wage. As governor, we will increase those wages. We will provide professional development and educational opportunities for those who want to be in education and early education. As a parallel, I'll say I'm proud to have sponsored the legislation that established universal transitional kindergarten, free preschool for every 4-year-old in the state of California. And this year, it's been fully funded. We will continue to support TK, but at the same time, put more money into early education programs for the infants, for the 1-year-olds, the 2-year-olds, the 3-year-olds. What we have to do in California is what other states have done. We have to establish universal child care. They've done it in New Mexico and in other states, and on my watch as governor, we will do that here in the great state of California.
Thank you, Superintendent. Ms. C, you're up.
Great, thank you very much, and thank you to the Women's Caucus for this important conversation. Look, one thing that's not been said is the term investment. You know, when I think about childcare, this is about an investment. It's about knowing that we are going to have really the economic support that so many rely on to be able to be full participants in the workforce. If I read one more headline about women leaving the workforce because they have to deal with inconsistent, unreliable care needs, this affects women first and fundamentally. But when I talk about an investment, it's this, and thank you to our superintendent for being a champion of TK. But when we actually enacted TK, it destabilized the child care system, because what we should have done with TK was to think about how do we incorporate the child care providers in the system now so that we're actually building a lasting system where we're uplifting everyone in the process. And so I frankly would say any first call on any new taxes, and I would want to work with the business community about this because it's an economic issue, should be on uplifting a child care system for the long term. It will be subsidized, but it's about paying our providers more. It's about being sure that we have reliable child care. It's about professionalizing the care workers and really fully funding the true cost of care. I mean, this is really, when you think about it, many child care providers actually end up making less than the minimum wage with all the things that they have to provide for on their own, whether it's professional development, looking at services that aren't covered, transportation, working weekend hours, evening hours. And so when I think about an investment, it's this. We make the case to the public that this is an investment that yields a return. And we are going to talk about what we're going to see by way of a return at each stage of our investment. So one, increasing wages. Two, being sure that we have more providers and that no part of the state is going without. And then three, how do we incorporate them into the larger system, and particularly as it relates to early childhood education. So, thank you.
Thank you, Ms. C. All right, next question. Unpaid caregiving and career interruptions leave many women financially vulnerable and unprepared for retirement. How would your administration strengthen paid leave, caregiver support, and long-term economic security for women? Mr. Mahan, we'll start with you.
Sorry, you got skipped. So, look, on the one hand, we have one of the more generous parental leave systems in the country. On the other hand, when you look globally, we lag. And when we talk about investment and ROI, there is no better ROI than empowering parents to be with their children in those earliest years and get them off to the best possible start. So the truth is, we, as a starting point, need to do at least two things. One is, as we have the ability to invest more, I think that one of the best investments we can make is moving toward longer paid parental leave times to come into line with many other countries around the world that understand how important those investments are. I've seen this as my wife and I have 2 little kids, And it is just, I think, one of the most, I think we will save money in the long run. We will have happier, healthier children. And I think there's great ROI to extending parental leave. The other is, there are disparities today, even with the existing paid leave policies that we have. And we see that it correlates largely with income. And I think we need to use the bully pulpit of the governor's office and our agencies to meet people where they are and make sure that they are aware of the benefits that they have, ensure that they are not retaliated against for taking advantage of those. We're paying for them for a reason, and in some cases, the families that most need them have barriers to actually accessing them and using them, and we all are worse off because of it. It's in our most under-resourced neighborhoods that we most want people to take advantage of these resources. So we need to make it easier to apply. We need to make sure everybody knows what those benefits are and that we are reaching them and that they're really getting that public benefit, because ultimately that's to the benefit of all of us in society. I don't think it's easy to do, but I think that as we have incremental dollars, this is an area where I would like to see us actually invest more.
Thank you, Mayor. Ms. T, we'll go with you next.
Could you repeat the question?
Absolutely. How would your administration strengthen paid leave, caregiver support, and long-term economic security for women?
Great, thank you. I would say that, when we think about these kinds of leave programs and what I would call kind of social insurance type models, there really does have to be an allowance for care. It's something that's, I think, done in other countries, but I think we have to just recognize that this is a big part of how we're going to provide economic security in the long term. So I hope that we can have, yes, more generous leave policies, but also, and I think about care not just with respect to the early age spectrum, but kind of throughout, so elder care as well. And if we actually think about it as a social insurance model, I think along the way we can actually build in more support for those who actually do need to take care of family members.
Thank you. Mr. Calderon, would you like me to repeat the question?
Nope.
You got it.
First, I want to thank the Women's Caucus for all the work that you have done over the last decade on these issues. You have led and you have created systems and attention that has led this nation. The biggest issue that we have is that we have not modernized in terms of delivering and the need that exists right now. I think one of the major failures of American culture and our society is that we've prioritized the job. We've prioritized the work. We haven't prioritized the family. As parents, we prioritize our families. We care about our kids. We understand how important it is in the formative years that we're home with them and how much beneficial it is to those kids long term. But our laws and our culture and our system has not prioritized it. They've done that in Europe. And we've seen the benefits and the successes of it. And California needs to lead the way of a revolution in terms of how we prioritize keeping families with their kids at a time when it is most significant and most important to them. And I'll never forget when we had our first, just navigating the process of just trying to get access to your unemployed paid family leave benefits was just so difficult. And then you realize, oh wait, I'm not gonna get the full salary, and then, which was Elisa's, and then that's significantly impactful to us because we were a two-income household because we didn't make enough on our own, and that was important. And so what we need is we need more certainty in the system. We need to be able to increase wage replacement so that it is paired to where we are currently at and where families are making so that they don't have the disruption and that uncertainty. We have to guarantee job protection so that you don't have to fear that you're going to lose your job because you got pregnant to have a kid, which is only an issue born with women, not men, and that shouldn't be a punishment. And cut red tape. We need to cut red tape. We need to make it easier to get your access to your benefits, and we need to cut red tape so that we can find more money so that we can fund this program and fund the wage replacement.
Thank you for that. Mr. Thurmond, we'll go with you next.
Like Ian, I'm proud to have voted for all the various bills over the years that we supported that were Women's Caucus priority bills around family leave, but there's still much more work that we need to go. I was also proud to be the sponsor, one of the sponsors of the Majority Leader's bill, the chair of this caucus, a bill that would extend parental leave for educators, and we'll continue to build in that area. and to go further. You know, thinking about the continuum of ages, I'm thinking about long-term care. And so many Californians and Americans are providing for an elderly Californian. I am, I know that Ms. Yee is and others are. And it can easily cost you more than $100,000 a year out of your pocket. Now, we have to strengthen and continue to support the IHSS program and make that possible for more caregiving support. But for those families who don't qualify for IHSS, we have to do more. And as governor, I intend to implement a pilot long-term care insurance program to help Californians care for a loved one who is aging so that we can continue to support them as they age in place. In terms of economic security, I've made it known throughout this campaign that I intend to offer Californians a tax credit so that you have more money in your pocket every single month to pay for the rising costs of gas, groceries, and housing. And I've been really plain that I will finance that by putting a tax on billionaires so that we have more revenue for working Californians and middle-class Californians. And then again, as a parallel, this year, I'm sponsoring legislation that would make kindergarten a requirement. You know, when my kids were in kindergarten, there was a lot of half-day kindergarten, and it forced us to find aftercare that was often costly, and leaving work to have to go and pick up our children and then take them to the aftercare. And so that's why I love the TK's focus on full day, and we'll make kindergarten full day, and we'll make it available to all California families.
Thank you, Superintendent. Mr. Becerra.
So when I became a member of Congress in 1993, there were no requirements for family leave. And we quickly in my office, because we control our budget in Congress, we implemented a family leave program. All of my life I've had a majority of women on my staff, and it became very obvious that we needed to address that for so many of the workforce. And I was also there in Congress when we passed the first national family leave policy. And since then, we've continued to try to plug the holes that still exist. California has obviously gone further as well. We have to make it so that we don't think of this as an afterthought. It is part of going into the workforce to have access to family leave. It lets you make the decision you want about where you will practice, where you will make your career, versus having to choose a place simply because you may have access to the leave policies that you'll need. And so we have to get to the point where we recognize that this is an investment that will help us in our economic affairs. I want to also though transition to the issue of home care. It's more generally, like I think Betty has mentioned, she cares for her mom. I care for my mom. I care for my father before he died. In fact, he spent his last days, his last breath was in my home. And it's something that just generationally we do. And that home care, I am fortunate to do. It was intentional, but there are many families that would love to be able to do the same thing, but they can't give up the income that they'd suffer if they try to spend the time with that loved one. We must treat home care as the main source of care in America and certainly in California. So I will move California towards home care. Those IHSS workers, they should have an opportunity to collectively bargain statewide, not county by county, because some counties try to rip them off. We have to have a standard so you know you can actually do this work. We will get that done because home care is the way of the future for California care.
Thank you, Secretary. Moving on to the topic of health. 1 in 4 Californians have received care at Planned Parenthood, and most patients rely on Medi-Cal. With the ongoing federal attacks on funding threatening closures, would you use state funds to keep these health centers open even during tight budgets? Mr. Calderon.
That's an easy yes. I think it's really important to underscore how important it is for this caucus and the members of this caucus to have a really strong working relationship with the next governor. I've had the privilege of serving under Governor Jerry Brown as well as under Governor Gavin Newsom. And when there isn't a working relationship between the legislature and the governor's office, people fall through the cracks. Priorities fall through the cracks. And this caucus is going to be able to help lead the future of what we do when it comes to access. I can't applaud more our reproductive health and how we are a leader nationally and a reproductive freedom state. The work that you have done, the work that Planned Parenthood has done, that has to continue. That has to continue to be a priority. But we also have to get real about the fact that we have a broken healthcare system. And this broken healthcare system needs to be reimagined. We don't even know what the cost of care actually is. And I know that us working together can solve these challenges and solve these problems because we all collectively pay $400 billion a year for healthcare. And there is another way to be able to provide guaranteed access to preventative care, primary care, mental health services, maternal care, catastrophic care, so that we have the certainty of knowing we can get care when we need it and that we're not going to be burdened for the rest of our lives. But it's also important that you have a strong working relationship with the next governor, because that next governor can't make the same mistake of vetoing AB 432, the menopause bill. Being able to work with the governor and explain to him and understand throughout the process why it was so important to have that access and to have those protections and have that bill signed, that was a failure and that was a mistake. And as governor, I would have signed that bill. And I look forward for us being able to work collaboratively on these issues.
Thank you. Secretary Becerra.
I just have to comment that as governor, I'm going to have somebody whispering in my ear when I go to bed at night, you better be signing that bill. She's a high-risk OBGYN. And so I know what we have to do. And I've been fortunate to have a maternal fetal medicine specialist at my side for decades, helping navigate what it means to have access to health care and certainly access to reproductive care. Now, here's where I think it's really important to make it clear. We cannot go backwards simply because Washington, D.C. has decided to cut Medicaid, which is Medi-Cal here, simply because Washington has decided not to extend the ACA premium tax credits, doesn't mean we have to follow along. We should not take the knee to Donald Trump. We should let him know, in California, we're going to continue that path towards universal coverage. And that means for everyone, regardless of your income, your zip code, or your status. But because at the end of the day, it saves us money. It's not because we're just trying to be noble, it's because it would be economically suicidal to tell a large population you don't have access anymore. They're still going to access care. They're just going to wait till it's so bad, they're so sick, that they go to the emergency room, where it's the most expensive care that they can get. And so we have to change the way we do business. And that's what I'm prepared to do. The governor just provided $90 million to Planned Parenthood, emergency funding. Absolutely. As governor, I will continue that. Not because I want to be a friend with Planned Parenthood and family planning, but because we need it. Because Planned Parenthood does more than just provide abortion care services. We need to be smart. And that's why when I'm governor, I will do what I did as Attorney General. I'll protect reproductive care. I will fight against the gag rule on Title X the way I did as AG. I will make sure that EMTALA is the emergency law that protects people who need to go in to a hospital to get the care they need, including an abortion. I will make sure mifepristone is available, as I did as Secretary of HHS. We will continue to move forward because that's the only way we'll get access to care at a reasonable price.
Thank you, Secretary. Superintendent Thurmond.
To the first part of the question about keeping the clinics open, yes, and to fully fund them. You know, I was proud to be a sponsor of Proposition 1, which enshrined the right to an abortion in the California state constitution. No matter what happens in Washington, D.C., we will continue to protect a woman's right to choose and access to care. For 20 years before I came into politics, I worked as a social worker. And I worked with Planned Parenthood, who helped many of our families with family planning. And I worked with Medi-Cal, Medicaid, and used it for school-based mental health programs and full wraparound health care programs. And we can't let anybody in DC or anywhere else bully us and stop us from enrolling our families in what really is a federal entitlement. That means that Medi-Cal and Medicaid, they're unlimited, and that anyone who qualifies should have access to that care. That's why I'm supporting this new healthcare billionaires tax, because we know that hospitals are going to close, emergency rooms are going to close, and people are going to be left without care. Their premiums in the Affordable Care Act are going to go up, and we're going to see Californians who are going to be in dangerous situations. At the end of the day, as governor, I intend to implement what will be a single-payer healthcare system, because everyone is entitled to have access to healthcare. You know, I had a brother who lost his job and lost his insurance, and he was diagnosed with a rare liver disorder, and he stopped seeing a doctor, and at the age of 35, it cost him his life. No one should die because they don't have access to insurance. Planned Parenthood has allowed for our families to have safe access to family planning, and I will continue to support it and continue to fund it and continue to expand healthcare, continue to expand Medi-Cal, and I will, as governor, restore healthcare for all for undocumented immigrants in our state.
Thank you, Superintendent. Misty, as governor, would you use state funds to keep these health centers open even during tight budgets?
Absolutely. And actually, I would propose that we also use our safety net rainy day fund to backfill. I just want there to be some assurance that those who depend on Planned Parenthood are still able to be served. You know, I'm thinking as my colleagues are responding about how we talk about reproductive health in so many ways. It's an economic issue. It's an economic issue. And this is all about setting families, and particularly women, back. It's about taking out the economic foundation of our democracy, frankly, when the federal government decides to defund Planned Parenthood. And it's also about how, when we look at healthcare here in California, it's just so destabilizing for these families. And so we have a growing wealth gap here in California, and I want to just kind of put it in a bigger frame of the economics. And it's affecting our Black and brown families and households the most. And it's now touching upon the middle class. And when we're not able to just recognize all of these issues really exacerbate that, we're just going to have a harder time in terms of staying caught up. And so this is non-negotiable. It is definitely the state needs to step up. But I want us to just think about it in terms of the bigger frame, and that is we can't have our Black and brown families continue to fall behind. And the state, I think, has been a leader in this, and I think we should continue to be a leader. And so, absolutely, yes.
Thank you, Ms. T. And Mayor Mahan.
Yes, I absolutely would use state funds to backfill. I want to thank the governor and legislature. I know that Senator Laird, who championed the $90 million in backfilling funding for Planned Parenthood that was taken away by this administration. As we have looked on in horror as the Trump administration has very actively tried to strip away women's rights and access to health, California has been a beacon of hope, and we will continue that as many of us, and certainly if I'm our next governor, I will continue to be a champion there. We also need to look at the fact that even in California, which has enshrined these rights in our Constitution, has backfilled funding for critical providers like Planned Parenthood, 40% of our counties, particularly our rural counties, have limited or no access to reproductive healthcare. So we need to actually do more than we've done and expand care, including telehealth and facilities that are brick and mortar. The challenge is this, though. We all, thus far, I think, have agreed on virtually every answer to every question, and the real challenge is cost. We have a broken healthcare system. We are spending 50% or more per capita than other comparable countries and getting worse health outcomes. And where I differ from the superintendent is I think a wealth tax is a failed policy that will actually drive the tax base out of state and make it harder to pay for these things. I think the real answer is going to be innovation, better alignment of incentives, having price transparency, in increasing our trained and skilled workforce in this area. And we're going to have to embrace technology to make our healthcare system more efficient so we can have more of it. Because we all agree we want to expand it, but I don't think most of us have a plan on how we're actually going to pay for it. And I think that's the real challenge with all of our very progressive goals is we have limited resources and have to use innovation and better incentives to actually get more of the things that we want.
Thank you, Mahan.
The mayor addressed me directly. May I have 30 seconds to redirect?
30 seconds, yes.
You know, it's not that we don't have a plan. Actually, we do have a plan. The measure that I support actually would keep those who are billionaires from being able to just change their residence to escape it. But myself and others will be working with people in Congress, including Senator Sanders, who's already said that we're going to move forward on a nationwide wealth tax. This will allow us to protect California. California has a revenue challenge. We can cut out waste and fraud and abuse, but without new revenue, we won't be able to meet the needs of the various services that are needed. So we do have a plan, and we will have revenue, and we will tax billionaires.
Thank you. All right, sticking to women's health, this is something that is under-researched and underfunded, causing misdiagnosis and economic setbacks. How would you invest in women's health research and care to protect both health and economic security? We'll start with you, Superintendent Thurmond.
This is an issue that's very deeply personal to me. My mom passed away from cervical cancer, and it was a misdiagnosis, and you know, she might still be with us today, but for that. I lost both my parents to cancer, and like Mr. Calderon and many of you legislators here today have supported twice now a tax credit for our biotech sector so we can have access to life-saving measures and resources and technology. And as governor, I will continue to invest in it. Our biotech sector might be up to $3 trillion worth in value. And when you think about it, there are double bottom line benefit. There is the benefit to healthcare and to saving lives. There is also the benefit to helping Californians get access to good paying jobs so they can afford and continue to stay in our state. And so as governor, I will double down on the investments that we make in research. And there is no reason that Black women should die in childbirth at a rate higher than women from other races. You can't tell me we can put a person on the moon and we can't find ways to create equity in how healthcare is delivered. That's why I provide scholarships to those who choose to enter into healthcare and mental health in rural communities, in suburban communities, in urban communities. We will continue to expand that. And I've introduced legislation that says we will help to defer the cost of becoming a doctor, a physician, a doula, a nurse practitioner, someone who will work in healthcare, and help us close this gap. We can accelerate the research. We can accelerate those who fill our workforce. We can accelerate research in biotech, make California #1 in this area, save lives, and create jobs, great paying jobs for Californians.
Thank you. Ms. C, what are some specific ways that you would invest in women's health, research, and care to protect both health and economic security?
Sure. So we have great research institutions right here in California. And I would say I would double down on the University of California with respect to putting a lot of the research capability there. I also would look at how we would have systems of knowledge sharing globally around this. Because what this research does is actually help us identify gaps. And it's going to inform a lot of the policy decisions about where we prioritize and what we fund. But California, I think, is like the straight laboratory because we're so diverse. Our geographic diversity, certainly the diversity of our people. So in terms of the findings that we are able to have our universities really get behind and to produce, I think that can be helpful beyond just the contours of California. But I also want to look at this as a global opportunity as well in terms of what we can develop with that research and have it be an economic driver as well.
Thank you, Ms. C. And Mr. Calderon, we'll go with you next.
One of the things that's been difficult for me as I travel the state and I talk to a lot of these communities, and especially going to communities of color, is I get this response, which is, you know, you guys come in here and you make a lot of promises. And then you get elected, and then you don't follow through on any of those promises that you've made to us. And it's really made it difficult for me to be in this position of, I know I was there, I was in the legislature, and these have been issues that have been plaguing communities for a long, long time, and yet they are still plaguing communities. The fact that we have women of color, specifically Black women in the state, that die at a rate 3 times higher childbirth than any other group is unacceptable. It is unacceptable. And when you compound these factors with the fact that we have a federal government that is hell-bent on punishing us because we are a blue state, that makes these problems exponentially worse because it threatens our ability to bring dollars down so that we can fund research, so that we can prevent these things from happening. And one of the things that I've talked a lot about during this campaign is making ourselves independent from the federal government. We always love to talk about being the 4th largest economy in the world. Well, we need to actually finally deliver on that. So I don't want to be under anyone's thumb. I don't want any president or any member of Congress to get upset about what it is that we're doing, protecting our values and protecting our people, and saying, well, we're going to stop funding you. You know what? Why don't we just fund ourselves? Because over a period of 5 to 6 years, we can invest in programs so that we can actually get the amount of money and generate the amount of money that we get from the federal government, and we don't need them. And that's where state leadership is going to go. That's where California can lead the way. We have to make investments in ourselves. We cannot rely on anybody else to support us. We got to take care of ourselves, and that's what I want to do, and that's how we're going to solve these challenges.
Thank you. And Mayor Mahan, we'll go with you next.
Thank you. Yeah, this is an issue that definitely hits close to home. My wife went through a major medical procedure followed by a really significant health issue that took over a year to diagnose. She has the BRCA gene and decided to take preventative measures and then became very ill. It's taken a long time to figure out why. And one of the specialists who probably had the best insight had a wait list of over 800 patients. So it was a very long time to figure out how to get to someone who had the direct experience to be able to diagnose what was going on. And I think that one of our great assets, as my colleagues up here have said, as a state, is our research capacity, our UC system and other universities and their proximity to the biotech sector. And so I think tax credits are a great idea, leveraging our research capacity. And this is an area where the investment has a multiplier effect, where when the public sector incentivizes more research, and in places like Mission Bay in San Francisco and San Diego, where we have a strong biotech sector, and elsewhere, we can actually spur the creation of new therapies, new technologies, and great high-paying private sector jobs that are downstream of the investments that we can and absolutely should make as a state in primary research. I think they go together, and it's a place where investing is not at all zero-sum. It's actually additive and grows the economy, grows the tax base, creates more jobs. So it's an area that I would absolutely prioritize for strategic investments through tax credits and research grants.
Thank you, Mayor. Secretary Becerra.
Carolina, my wife, was one of the authors of one of the seminal studies on the disproportionate impact that disparities have on the outcomes of health, especially for women and babies. And that was done back in the 90s. And still we see that we haven't seen the type of investment in the types of services that we know can save lives. I will say this, under my watch at HHS, we had the highest level of investment in women's health and reproductive health care ever in the history of the United States government. And as a result, because several of my colleagues have mentioned this, we changed the dynamic where a woman on Medicaid, Medi-Cal here, used to only get access to health care after she delivered her baby for her and her baby for 60 days. We changed that because of all the studies that showed that so many women, especially in the Black and Native American community, have 3 to 4 times the rate of mortality of white women. We changed that and we provided 365 days of care under the Medicaid program for states that would adopt that program. Today, 49 of the 50 states have adopted that program. So today, almost all women who deliver a baby have access to care under Medicaid, under Medi-Cal here in California for 365. What else? What else? Let's keep going through. What else did we do? We made sure we set up a maternal mental health hotline because sometimes women don't know where to turn. We set up Medicaid reimbursement for doula care. We were able to set up a program that made it possible for women to access their records and make sure that it was private so that others could not access their private information. What we did was we also invested more money in women's research than ever in the history of the country. Look up ARPA-H, A-R-P-A-H. That's the Department of Health and Human Services program that's supposed to be the innovator, and we put in $100 million in what we call the Sprint to Women's Health to start innovative projects and complete those that are waiting for a little bit of funding. We did more in my 4 years for women's health than had ever been done at the federal level.
Thank you. Moving on to the last portion of our conversation, we're going to get to the topic of safety. Ms. Yee, violence and harassment against women, including extremist attacks and online threats, are on the rise. What policies or actions would you take as governor to keep women safe in public and online spaces?
Thank you. Well, first of all, I think we need to really hold our social media companies accountable. I know, and I want to thank the Women's Caucus for playing a leadership role in this. Look, these are conscious decisions that they're making about what is allowed online. And to promote that kind of violence and harassment is just unacceptable. It's not acceptable. So we, as a matter of policy, can do something about that. The other thing I would say is, whether it's home or workplace, I think there's more that we can do in the workplace with respect to having employers play a bigger role in this. And really as a matter of public education, what does this really lead to? This is all about a power dynamic. It's about a power dynamic about weakening the position of women to where many who are victims of this don't believe that they have a base to stand on. And so this is where I hope that we can, as a state, really, and this is an area that I would mandate, that every employer do provide really robust training for all their employees, and then also hold them to account for doing that. So social media companies, much more responsibility, looking at a workplace responsibility by employers, and then a matter of just broader public education about the detriments of not doing any of that.
Thank you. Mr. Mayor, moving on to you.
Thank you. Just to add on that, I appreciate those policy directions, and I think on top of that, I'd say at the more extreme violent end of the spectrum, there's a lot more work to do around gun violence restraining orders. That's a tool we've been using very actively in San Jose and Santa Clara County between our police department, our DA's office, the judicial bench, to intervene earlier, make sure we were getting weapons out of the hands of abusers, create alternative safe places for survivors. And I think the tool can be used more effectively. It's being underutilized in many counties in the state. I think the state can bring data and best practices and a little bit of funding to bear to increase capacity. There's some counties where verifying that there's no longer a weapon in the home, for example, is actually self-reported, which is crazy. So I think we need to dig down into, and I'm just talking about at that end of the spectrum. I think what you spoke to was kind of at the front end of culture and social media companies and education and the workplace. As we get down to the home, to the criminal justice system, we need to make sure also that if abusers are being diverted into a diversion program, that there's accountability and that it actually is working, and that intervention actually leads to behavior change, and that women are not put in the position, women, children, victims, survivors are not put in the position of having no choice but to live with their abusers again. And one thing we've done in San Jose that I'm very proud of is we've massively expanded transitional housing to have alternatives for people, to have places for people to go that are subsidized, that are safe, that are fast and available. We don't have to wait to build new housing. There's an available stock of transitional housing, which is useful in many contexts, protecting survivors, re-entry from the criminal justice system, ending unsheltered homelessness. I think that's a tool the state should be looking to expand in communities across California.
Thank you, Mayor. And Mr. Calderon, we'll move on with you.
I think it starts by continuing to sign bills like AB 250 by Assemblymember and Majority Leader Aguiar-Curry, and making sure that we actually build on that bill and expand on civil and criminal accountability and perpetrators and entities that cover up abuse. In this modern day and age, part of being married and marriage is communicating through social media, and we do that through memes, my wife and I. And one of the things that she sent me yesterday was, I couldn't see what it was, but it was just, see, this is why I don't go out in public with the kids alone. And it was a woman who was walking a mom walking out of the store, and a man just came up and grabbed her kid and threw them to the ground and started running off with her kid. And that is terrifying. And, you know, the fact that, you know, we live in areas where, you know, you don't want to park next to a van, or you don't want to get into your car where there's a van parked right next to you because there could be somebody that's going to jump out and pull you in, and, you know, and then you end up in sex trafficking. I think we need to have greater resources to be able to work with law enforcement to prevent that. But then also at the same time, I am terrified about my kids and their interactions with social media. And what I find being a significant challenge for me as a parent, and what I see just, you know, with the kids that are, you know, my kids go to school with, and those families, is that there really is a lack of understanding of how significant the problem really is, and how you think you're watching kids YouTube, but your kids are they're being exposed to content to make them believe a certain way that ends up making them a victim long-term in their lives. And we have to have accountability. I agree with what Betty E says. You know, it isn't enough to say, well, it isn't our content, so we're not responsible for what your kids or what people are exposed to. No, there have to be accountability measures, and all of us together, including industry and people that are providing these platforms, have a responsibility to keep our kids and our families safe.
Thank you. And Secretary Becerra, what policies or actions would you take as governor to keep women safe in public and online spaces?
So let's first recognize that most of the victims of harassment and violence, sexual harassment and violence, know their perpetrator. And it is unfathomable that we continue to close our eyes to what we know is going on, especially when it's domestic. This whole debacle with Jeffrey Epstein essentially highlights the way America treats this issue. We know that there were predators, we know that there were child perpetrators who were taking advantage of minors. Yet has any one person been prosecuted that participated in that? That's how deep this runs. No mas. And certainly not in California. We cannot let that be the case. We have to make it very clear that we will aggressively enforce, and I say this not just as governor, I say this as the former Attorney General. We must aggressively enforce our laws. And secondly, we must robustly support through programs and services the victims of this harassment, of this violence. When I was Attorney General, we upped the number of sex trafficking investigations that we conducted because we knew it was rampant, especially in the Central Valley of California. And we also upped the program that provides for retrieving of weapons by people who actually have a license to own a weapon in California, but have committed some kind of offense that now gives them, they now lose the right to possess that weapon. That program, the Armed Prohibited Persons System, allows us to go get those weapons from those individuals. On a daily basis, my special agents were collecting firearms from individuals who had lost the right to hold them. We have to be aggressive in enforcement, and we have to be true and robust in supporting the victims.
Thank you. And finally, Superintendent Thurmond.
Thank you. The laws that you were talking about, Mr. Secretary, many of us voted for them. They're called red flag laws, and they say that when someone represents a danger, that they have to be without a weapon. And I agree with you. We can strengthen those red flag laws. We have to have as a policy that we will never, ever question a woman who has been impacted by violence. When there is a report, it must be treated. There must be an opportunity to provide shelter and safety and to provide protection. We have to give victims the ability to sometimes testify remotely because sometimes they are intimidated when they are forced to be face down by their harasser or their abuser. As I mentioned, my 20 years of social work, I've worked with many individuals, women and men, who have found themselves on the other end of domestic violence and needed protection from the law. And sometimes it was difficult to even get that protection. And so there should never be a doubt of someone who has experienced abuse or a threat. And I appreciate Ms. E's mention of social media. There's a place that we have to go further in the law on social media. And I've seen this in our schools, and I was pleased to support our ban of cell phones in schools. You know, the social media companies are not allowed to communicate with the police when they see a threat online. And That is absurd to me, because we have the ability to do prevention. And that is probably the most important thing that we can do, is prevent harm as we see the risk growing. And so as governor, I will work to strengthen those laws on how social media is regulated and that they have to report this information to support our victims, to make sure they have access to restraining orders, that they can testify remotely, and that we change practices in how we even work with our young people, that they get training in empathy and how to treat each other with respect and decency.
Thank you, Superintendent. This is our final question before we get a chance to open up to the audience for questions. So, women and children across California face high rates of domestic violence, sexual assault, child abuse, and trafficking, with federal funding being inconsistent and state support often being short-term. How would you ensure stable, long-term funding, including VOCA funds, for services supporting crime victims? And we're going to start with Mayor Mahan.
So a couple of thoughts on this. One is we need to better fund the court system so people have access to timely justice. The wait times are unacceptable and put an undue burden on victims. Number two, as I started to talk about, San Jose has led the way in expanding interim and transitional housing, which has many different applications. It is not the full solution, but we need to have safe, private places with on-site services for people to be who are in transition, who need help. We have 2 of our sites dedicated to families, almost exclusively single moms with children, many of whom are victims of domestic violence. And it is that safe, dedicated place in a supportive environment with case management, on-site childcare and services that help them stabilize, get access to services ranging from job training to mental health counseling to start to rebuild their lives. That is a cost-effective intervention. So you get timely justice, a safe place to be with access to services, and really high-quality services that help people to be able to establish a sustainable life that may look different than their life did previously. And so I think finally, I'll just go back to what I said before. Unfortunately, we don't have unlimited resources. I don't think what we have is a revenue problem. I think what we have to do to help our most vulnerable residents is remove barriers to the things that we most need, like building housing, to bring down costs. All of these issues intersect with one another, and when we fail on housing or delivering higher quality public schools or ensuring that our diversion programs actually work and create accountability for people to get on a different path in their lives, it all feeds into a system that becomes something that we almost can't afford to fix. And so we have to get at the more foundational issues of bringing down costs, making things less expensive, and making our society work better for working and middle-class families, or we're never going to be able to have enough programs and patchwork of things to actually solve these problems.
Thank you, Mayor. And Ms. Lee?
You know, I think there are a lot of programs in place now that we can modernize and actually really meet the need better. But I want to go back to kind of a fundamental barrier that still exists for women, and that is they're not believed. They still have to really make their case. And so how do we create the support for them so that they're actually part of a system where their experiences are ones that people can understand, where we can provide the appropriate support, and that hopefully they can be in safe and trusting environments. But I do want to just say an example of how we can modernize one of the programs. I was happy to be a sponsor of the bill, and I was controller. I was a member of the Victims Compensation Board, and we are compensating victims of human trafficking from that board. It was vetoed the first time, even though we had surpluses in the fund. And it's unique in that situation because we generally need documentation related to prior employment. Well, when you're a victim of trafficking, that documentation is not there. And so we have to just look at what's already in place in terms of these programs that can be modernized to meet the needs of what women are experiencing today. And I think there are a lot of avenues where we can do better.
Thank you. Superintendent Thurmond.
You know, I'm not going to ask for another 30 seconds, but I will say this. Every sector, ours is the only, government and nonprofit is the only sector where people always tell us that we have to find a way to do more with less. In the for-profit sector, they are not saying that at all. they recognize their productivity has something to do with the investments that you put in. The first thing I learned here as a legislator is that you show your values by what you put in your budget. And as governor, I'm going to see to it that we put the resources that we need in our budget to support our families. In every county, we should have a family justice center that can bring the multitude of resources to support someone who's been a victim. We should have multilingual services so that people can be served in their own language. Many people don't know that it is their right to have access to these services that will protect them. We should have peer navigators, those who have lived experience, that they've dealt with it, that they can coach other victims and help them, to support them. And we should always find a way to make sure that we listen to our victims, that we can communicate, and that they know about the resources that are available. We can build these programs. We have to have the commitment that we're going to do it. And as governor, I'm going to work on the programs that will relieve the strain that so many of our families experience. Yes, I promise we will build 2 million housing units by the year 2030. We will provide a down payment assistance program, a tax credit for the families who are struggling. We have the ability to provide support for those 10,000 youth who are homeless right now as we speak. We must do these because government is called on to provide solutions to the challenges that we face. And we're in our toughest moment than we've ever been. And I still believe in California, and we're gonna stand up and we're gonna move forward together. Thank you so much for having me here tonight. I apologize I'll miss some of your questions because I have a previous engagement, but please reach out to me either at Tony@TonyThurmond.com, call me on my bat phone, 1-800 where you at. We'll get right back to you. Thank you so much for this opportunity tonight.
Thank you. Mr. Calderon.
Well, as I said previously, I think we need to expand on the work of our majority leader and AB 250 and extending the statute of limitations so that survivors can get the justice that they need and that they deserve. I think it's really important that we stabilize our funding sources, specifically VOCA dollars. At least, when it comes to us fighting the federal government, we have to have a reliability and make up the gap and make up the difference in state funding so that those dollars can continue to fund the resources that are so necessary here at the state level. And when it comes to finding those dollars, we have to initiate forensic audits of all state spending programs. We have a patchwork of how we fund priorities in the state of California. And it's such a big budget and there's so many different moving pieces to it that we have to know where we actually stand. We have to know where the money is going and we have to understand the return on investment that we're getting. And when we initiate these forensic audits, we are going to be able to understand, okay, is this tax credit still relevant and is it doing its job? Are these funding programs that we've continued to approve decade after decade, are they still doing their jobs? Are we prosecuting fraud? Are we eliminating waste? We have the money. We just have to be more responsible about how we're spending it. And that comes through direct collaboration between the governor's office, the administration, and the legislature so that we are working collaboratively to find these dollars and fund these programs to provide the resources so that we do not continue to victimize survivors over and over and over again because they can't get access to resources because our politics has become so extreme and so detached from humanity that we have to rely on ourselves, we have to protect ourselves, and I think that that's what this state, the women of this state, and the people of this state are going to expect from us in the next administration. Thank you all for having me.
Thank you, Calderon. And finally, Secretary Becerra.
So when we would do these sex trafficking takedowns, we would find a lot of, mostly girls, there were some boys. They were very disassociated from their families. They didn't want to go home. Sometimes they were too embarrassed. They needed services. We had a small pot of money that we used to help stabilize them, keep them safe, because oftentimes the crime rings would try to go after them if they try to speak. But we have to invest some money in this. Legal services, the mental health support, the temporary housing, employment training so we can get them away from this because most of them are going to return to that activity because they don't have another way to survive. And so we have to be serious about this. I am where Superintendent Thurmond is. We need revenue. There is no way we can do all the things that we've talked about, healthcare, education, housing, without revenue. We need to make an investment in this because it's our daughters and our sons. Most people used to think that sex-trafficked children were foreign. They're in our backyard. They're our daughters and our sons. They just happen to go wayward or lose track of family. We need to do more to help them because they're still young and they'd like to get out of that trap, but it's very difficult. So my job as governor will be to put the real resources in. I saw it when I was AG. I saw what we needed to do. As governor, I will put the resources in. And if I don't see enough resources, we will get the revenue because we're shortchanging our future. Either that or you're condemning these young children to a life that they will never be able to escape.
Thank you so much. As promised, we're going to move on to the Q&A portion of the event. And members of the press, most of the candidates will be available after. So we'll go ahead and have you answer the questions after this part's for the audience. Assemblymember Bonta, go ahead.
Great to be with you all, and thank you for supporting the Women's Democratic Caucus in this forum. My question is around women's economic prosperity. 50% of California's population are women. We know it is well documented that there's a pay equity gap where women make 80 to 82 cents on the dollar as compared to men, and Latino and Black women make 65 to 70 cents on that same dollar. There's also an issue with the investment resources. Only about 2 to 3% of venture capital is invested in women-led founding organizations and companies. My question to you is, given that one of the drivers of that is Prop 209, would you consider championing the repeal of Prop 209? And if not, how would you use the state's procurement facility to be able to ensure that we were righting the wrongs both around investment and pay equity?
Anyone want to go first? Missy.
Yeah, thank you for that, Assemblymember Bonta. So I have and will continue to champion repealing 209. This has had a huge impact on women across the board. You know, with respect to procurement, I would say I really would like to see a robust disclosure program with respect to who the state will do business with. I mean, if we are actually aiding the continued inequities with respect to just earnings by women, I think we're setting ourselves back. We're part of the problem. So we need to have robust disclosure, and then also looking at how we can be sure that we're doing business with the companies that have a commitment to this, and also being able to connect up those companies with other governmental entities.
All right. Mr. Mahan, do you want to answer?
Sure. On procurement, what we've been doing in San Jose that I think has been moving the needle for contractors, for example, who are often they're left out of the process, is we have had dedicated workshops where we have met people where they are and actually ensured that we help them to navigate, simplify the process, know when we are purchasing various goods and services on behalf of our residents using public dollars, and helped make that really accessible to people. And we have used measurement and reporting to show how we have increased the percentage of contracts that have gone to small, minority-owned, locally-owned, women-owned businesses in the city, and very explicitly tried to diversify the pipeline of applicants. So rather than guaranteeing a certain outcome, which can run afoul of federal law, we have focused on the upfront training, capacity building, marketing to make sure we're doing the capacity building and diversifying the applicant pool and making sure everyone is competitive.
Assemblymember, thank you for your question. One of the things that we had done when we were looking at the film tax credit program during my tenure in the legislature is here you have this voluntary tax credit program, but we're having issues of workplace harassment, sexual harassment, as well as gender and equity, diversity, and where those dollars are going, and you know, who are the people that are getting access to these funds, and the communities that they represent, and how we could encourage diversity in these programs as a way to hold to account, to make sure that there were resources that were equitably delivered, and that, you know, you don't have somebody who, you know, represents a certain, you know, demographic being played by someone not representative of that demographic. And what we had done is we put in specific requirements, reporting requirements to show, okay, do you have a program that you're implementing? If you implement a program, what is the success of that program? But because this is a voluntary program, we cannot require you to do that. So you have to then say that you do not have a program, which, good luck, and go, you know, with the process of not being able to show that you have implemented a diversity program. And so what we need more accountability, and we need more reporting and information so that we can specifically target and target not just industries, groups, and the delivery of where our state dollars are going, so that we have a clear understanding that this is where it's going. We need a more equitable delivery and access to those funds, so that there's diversity in the disbursements of those dollars. And then when I was in the legislature, we did work on Proposition 209 and understood the importance of being able to have that conversation and the impediments that we are facing as a result of that policy.
Thank you.
So only in certain dark corners of this country, by the way, forgive me, I thought my voice would hold out, but these last couple of days of traveling on a plane, I'm beginning to, now my throat is closing up on me, so hopefully I survive. I was about to say, only in certain dark corners of this country, like 1600 Pennsylvania Avenue, do we still have people who say that racism has been abolished, that we are now a colorblind society. Jesse Jackson is probably turning in his grave these days, seeing what's happening. And what I can tell you is this: Prop 209 became a legal impediment, because most of us know that if you give a kid a chance, I'm the first in my family to have an opportunity to go to a university. You give a kid a chance, they'll prove themselves. And all we have to do is show that if you are among many people who are qualified, we can then pick among those qualified and see where we go. You just have to give people a chance. 209 took away the chance for so many of our young people. That is the worst thing about it. And I believe we will be able to undo 209, because we recognize that in a state as diverse as California, we don't want to be where 1600 Pennsylvania Avenue is. We want to give everyone a chance to prove themselves.
Thank you. I do see we have a little bit of a line, so we're going to start limiting the answers to just 1 minute. And let us know if you guys want someone to go first. Otherwise, I'll pick, but Senator Richardson, go ahead.
Thank you. Good evening to all of you, and thank you for being here. I have 3 questions that are all related to funding that you can simply answer yes or no. The first question is, 1, would you support something in the budget that would say that no state funds can be used for automation that would replace a current direct job? Yes or no? The second question is, would you support equalizing funding 100% for public and distressed hospitals that are currently receiving a reimbursement anywhere between 75 and 80%, which is why they're distressed and they're on the verge of closing? The third and final one is, I appreciate all the wonderful comments, but I just sat through a 3 to 4 hour budget hearing, and the Department of Finance and the LAO, which is Legislative Analyst's Office, none of them said that modernization was going to help us solve a deficit of anywhere between 20 billion and 50 billion over the next couple of years. So are you willing to raise taxes? Those are my 3 questions, and they're all similarly related.
Anyone you want to go first?
All of them. All quickly, yes or no?
Senator, yes to revenue. I said it already. We need it. The second question, more difficult because it's not as straight yet. Having run the largest health enterprise in the world, I know what it takes: Medicare, Medicaid, Affordable Care Act. But we will go where you're saying, because if providers don't get reimbursed, they will close. And the ones that are closing first are in the places we need them most. That's why I've said, as California's next healthcare governor, we will not go backwards, and the state will, and I'll need your help, because the state will be the backstop on healthcare. We will make sure providers know that they will get reimbursed for care. Even though Trump has tried to cut funding for Medi-Cal and ACA subsidies, we won't go there. We'll tell those providers, still see those patients, because they still will have Medi-Cal, because if I insure your payment, you'll keep your doors open. What was the first one?
The first one had to do with automation. Would you support no public funding used to automate that would replace a direct current job?
AI or all this automation must supplement, not supplant, a California worker.
Thank you.
I agree on number one, and no public fund should be taking anybody's job away from them. This technology should be used to our advantage, should be used to improve our lives and make it easier for us to do our jobs and make us more efficient and effective at doing our jobs, not taking our jobs away. Number two, remind me the question.
Supplement distressed in public hospitals.
Yes. Number three.
Thank you.
Number three.
You answered. Revenue.
Oh, okay.
Thanks for the questions. On your first, in San Jose, we're leading the largest AI workforce upskilling program, and we firmly believe that AI and new tools should help our workforce to be more productive, get some of the drudgery out of the work, and make it more enjoyable and impactful. But I would be worried about a very strict restriction as you're describing, because over time, we're talking about this at our transit agency, automation of vehicles may mean that folks who are operators ultimately become ambassadors or fare inspectors. And so I do think the nature of work will change, and we need flexibility to best use our public dollars for maximum public impact. So I'd be a little—
So you support using public funds and state funds towards automation that would replace a current job?
What I
That's
support—
what you said.
No, what I'm saying is I support using innovation and training our workforce and using new tools to be more productive, but I do want to maintain the flexibility to ensure that as certain jobs that are essentially discrete tasks become automatable, that we actually can have a just transition to have people do things that are more needed, better leverage our
Mr.
human
Mahan,
skills.
sorry to interrupt you, we just got
I know,
six
sorry,
time.
no, I'm trying to respond to the follow-up question. On hospitals, I think I agree with the Secretary on moving toward fuller reimbursement, though I'm not sure I totally understand the question. And then on the final, I have supported revenue increases, including a Measure A in our county to protect our hospitals. But by and large, my attitude is, as the second highest tax burden state in the country with one of the most progressive tax structures in the country, we are at a point where we mostly need to ask government to do better and be more efficient and effective before we ask people to pay more, by and large. Doesn't mean I won't support targeted revenue increases, but I don't think that can be our primary answer to having more impact for the public dollars that we have.
Thank you.
Yes to revenue, yes to closing the funding gap with respect to hospitals, and I would not support any public funding in terms of facilitating AI replacing workers. But let me just say something about modernization. You have to task the state workforce to think about how to modernize. They know how to do it. We never ask them. And I think we make a better case for revenue when we actually go to the voters and we're actually using that revenue in a more efficient way. So I would really encourage you all to do that. We went through this during COVID and we survived. The state did well, but it was because our state workforce stepped up to the plate in terms of how we modernized a lot of operations.
Thank you very much.
Thank you, Senator.
Hello, thank you all for being here today. I really appreciate it. This is going to be my first election voting for governor. I'm also a second semester sophomore at Sacramento State University as a political science major, as many of the lovely women in this audience have given me their business cards. But I think in asking important questions that regard to me, but also something that I think is important is speaking up for people who can't be here to speak for themselves. I want to know what my governor is going to do to protect me, my trans brothers and sisters, and my non-binary siblings as well. How they're going to protect our health, how they're going to protect our safety. As we know, Black trans women are facing the most violence. How are they going to protect me when there's current administrations that don't want to protect our way of life and being able to let us live and be happy?
Thank you for the question. Under 1 minute, please.
It is important and incumbent upon us to protect every Californian equally. We do not tolerate two-tiered systems. California has a history and has been a leader for decades on LGBTQ plus rights and making sure that people feel welcomed here and that they can live with comfortability and they can live a dignified life. And under my administration, that will continue.
Thank you. I have to just say, it's shameful how this administration has really devalued and dehumanized our trans siblings. And frankly, it gets me to think about if we are able to let this pass, I think about every morning, who's next? And so this has to be about including everyone when we talk about an agenda of economic security and safety and health. And it's also about how we are going to be sure that we're creating safe spaces and environments for everyone to live and to thrive.
Thanks for the question, and good luck with making your choice in your first election, or first time voting for governor at least, and thank you for being here. I strongly agree with my colleagues. I think what is so core to our culture, our values as Californians, is that notion of inclusivity, everyone having fundamental political equality, but also having policies and investments that enable everyone to thrive, to be who they truly are and achieve their full potential in our society. That's something we cherish, and I agree. I think it is disgraceful how attacks coming from the right have singled out some of our most vulnerable neighbors and tried to score cheap political points by scaring and dividing people. And as governor, I will absolutely use the bully pulpit as well as the courts and our budget and legislative capacity to stand up for our trans community and other traditionally marginalized communities who need a champion.
Thank you for stepping up, first and foremost. Appreciate that, and I hope you will tell all your colleagues in college and elsewhere that this election is most important for you. If we do this right as candidates for governor, we do this for you, because most of us have been able to buy our house. Most of us have gotten our kids ready for college. Most of us have a pretty set path to be able to retire. This is for you. And so what I will tell you is this: when I was Attorney General and the Trump administration tried to go after healthcare and the Affordable Care Act, that was specifically there for LGBTQ and trans, we put up a fight and we stopped him from doing that. As Secretary of Health and Human Services, when I would go up and testify in Congress, I would get raked over the coals because I made it clear when it comes to healthcare for any American, what drove us was the science, not the politics. And so we relied on what the medical associations and the medical experts said was the right way to do healthcare. And when it came to trans care, we relied on the scientists. And that's what we'll do as when I'm governor. We will protect the rights of every Californian to stand up and live a full life.
Thank you. Thank you so much.
Hi there, I'm Jennifer Greppy. I'm the Director of Parent Policy with Parent Voices California. And we represent thousands of parents from all across the state who are here on a regular basis in Sacramento fighting to make sure that we have access to basic services for our kids and our families. 1 in 9 kids are getting the early education that they need and deserve right now. We have over 2 million kids in California who are eligible for childcare who aren't getting it. We have done a lot to sort of take some steps to get us to serving families. But childcare is only one of the things that families need. Families need a robust safety net system that supports them. My question to you is, will you choose children and families over billionaires? Because the only way that we are going to fund a system that truly and robustly supports families is to have a revenue system that changes here in California. And so that's my question. Thank you.
I would say yes, and what I think is important to understand is how you do that. What I want is long-term sustained funding. I think there is nobody that would disagree that billionaires need to pay more in taxes. And so that means that because you have a high net worth and you have assets that you can borrow money against, and get a loan, well, that loan isn't considered income, so therefore you don't pay taxes as a result of that. No, you're gonna pay income taxes for borrowing against your assets and taking a loan against your assets. Water's Edge, ending that exemption so that we can generate revenue. We can generate $2-3 billion annually just from doing small changes that they will have to accept, because we need that revenue, we need that funding, and we need a secure future. And this is something that I will absolutely work on as governor.
I will tell you that when we make that fight, what's going to be most important is to make it clear what we need, where we need it, and give the public a clear sense of how it will be used, so they will stay with us. But what I typically tell folks, so they understand where I will collect revenue, is the easiest way to describe it is to say this. If you are a multi-millionaire, billionaire, you are uber wealthy, but you are paying at a tax rate that's lower than the teacher, the nurse, the police officer, or the firefighter, then expect to pay more taxes, because you're not doing your fair share. And everyone should do their fair share. And if we work with that understanding, we can get there. The other thing I think that has to be clear is, to Ian's point, it has to be predictable, because these legislators have to know how they can forecast what's needed and what kind of programs and services we can continue forward. So I will work with them to make sure that we provide a stable, predictable budget process, and we fund what we need.
Yes, to your question. But I would agree with my colleagues. It has to be stable revenue, and it really has to be one where we can count on it for the long term. You know, when I think about this budget that's before all of you, you know, being a former state budget director, we're not going to be able to tax our way out of the deficit, nor will we be able to cut our way out of the deficit. And I do believe the thing that I hope we can all talk about is, how do we invest in our people and grow our economy? And really make that investment with respect to certainly childcare and so many other things. But we have, and why it needs to be stable is because we probably have taken borrowing off the table, because we don't have, we'll pay a premium in terms of our debt service that actually could be dollars going towards programs. So I am going to be looking for that stable source of revenue, and yes, against billionaires.
Thanks for the question. I appreciate my colleague's point about sustainability ongoing. Unfortunately, the threat of a one-time wealth tax has already sent over $1 trillion out of the state and has likely cost us billions per year in recurring revenue. As Ian said, there are smarter ways to tackle extreme concentrations of wealth and ensure that the wealthiest amongst us pay their fair share, from carried interest to the capital gains tax rate, to the fact that you can endlessly borrow against appreciated assets and never pay taxes on them, to inheritance, where Elon Musk could theoretically pass $500 billion of appreciated stock onto his kids, and they never pay a tax, because upon his passing, it would automatically get marked up to market rate. There are a ton of loopholes in the tax code that ought to be closed to make sure that the wealthiest amongst us pay their fair share. But I will also say we have to grow the economy and grow the tax base. That is absolutely right. There's no amount of taxation that's going to get us there. And we have to ask ourselves in California how we will reduce regulation, use tort reform and other tools to actually have a growing economy and allow people to build things and invest again, or we're not going to get out of the fiscal challenges that we're in.
Thank you, Mayor.
Yeah, thank you. And I just wanted to also say that
I'm sorry, we have to get to the next question.
whoever our next governor is, we hope that you will listen to the people who are directly impacted by these issues and give us a seat at the table. Thank you.
Thank you.
Good afternoon, Senator Caroline Major, Vice Chair of the Women's Caucus. The Women's Caucus recently has highlighted the treatment of women in our incarceration system because in the past couple of years it's come to light that CDCR staff, from officers to OBGYNs, have sexually assaulted the women. A couple of weeks ago, there was an article of a video showing a woman getting pepper sprayed as a retaliation for coming forward on attacks. We have failed to care for the women in our prisons right now. I'm wondering, under a minute, your thoughts on reimagining how we treat people in our incarcerated system, specifically our women.
Mr. Becerra.
Well, one of the things we have to do is make sure we have more women who are working in these institutions so that they can provide the care that's more appropriate for some of the women we have in incarceration. Secondly, we have to put the R back into CDCR, which is rehabilitation. We have to have a program that tries to help individuals who, most of them, will be at some point leaving the institution, and get them ready for that. And then third, we have to make sure that we're doing real oversight over the work that's being done, because so often so much of the harm that's done is done right under the nose of the people who are supposed to be protecting these individuals. And so we can do far more to make sure that these institutions are not endangering the lives of some of these women. I also believe that Trump has opened the door for us to take a look at the pardoning power. And I think it's really time for us to use the pardoning power to try to help people, men or women, who've proven that they have rehabilitated and they serve no good purpose staying locked up in jail. And so what we can do is get them out there into the community again.
Yeah, I'm in agreement with much of what my colleague says, but I also think it's important that we bring legislators like yourself and stakeholders to the table so that we can truly evaluate how we can reimagine how we deliver, how we manage our criminal justice system and how these current policies are impacting inmates, especially women and women of color. There has to be a dedicated effort of actually moving forward on policy. There can't just be talk about it. And so being able to bring stakeholders like yourself to the table who are on the ground, who are fighting for this fight to the table so that the governor is there and putting the weight of the administration behind moving towards actual substantive policies is going to be important and something that I'd want to do very early on day one.
I appreciate you highlighting this issue. And like, people who are incarcerated still have rights. And when those rights are violated, there needs to be accountability. We need to send a clear signal that you're still a human being, and the focus should be on rehabilitation. So in those examples, I think it is important that there's accountability. But overall, the systemic change we need really involves getting the stakeholders involved, from those with lived experience with incarceration to those the workforce managing the system, to those of us who are policymakers and academic experts together to create more rehabilitative spaces and learn best practices from other countries that frankly do this much better. And I know some of that work is already being led by our state government. I've been following it. My mom used to teach in the prison system. And I know we can do better. The key is having to focus on it and say we're going to get people together and pilot new approaches and prove that we can get better outcomes and rehabilitate people and then spread those best practices through the entire system.
Actually, we have to set up alternatives in the community. You know, this is a culture within a system that I think is really deeply ingrained. And I'm not so sure that just even bringing, just additional personnel in that look like, who we're incarcerating is going to make a difference. So I would be in favor of more community-based programming, and also looking at how we can bring those necessary supports for those women who have been the victims of violence, and really be sure that we're dealing with the traumatic experience.
Thank you. We have 5 minutes left, which means we're only going to get to about 2 more questions. And I know a lot of the candidates have to leave, and we want to make sure the press gets to ask any of them questions on their way out. So please keep it under 1 minute or even less.
So Assemblymember Tasha Berner from Coastal San Diego. In 15 words or less, if you were elected governor, what would be the first action you would take in the state of California as governor to benefit women?
Missy?
Yeah. So I would make the first call for any new tax increase to essentially start uplifting our childcare system. It's foundational.
That's 15 words.
Less than
Okay,
15.
Okay, all right.
Mayor Mahan, go ahead.
I was going to say expansion of childcare as well. It's so foundational.
I'll go down the line. Mr. Calderon.
Working with you to cap childcare costs of $500 a month for families across the state.
Yeah, childcare.
All right, I think we're going to have time for one more after Ms. Calderon.
Hi, I'm Assemblywoman Lisa Calderon, and I have a yes/no. It's a yes/no answer. If you were governor today, would you call for the CEO of LA 28, Casey Wasserman, to resign?
Yes.
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 Thank you.
Thank you. Go ahead, ma'am.
Well, whether it be by choice or by not, it's 2026, so we can acknowledge that women are more and more single, without children, without husbands. It would go a long way towards women's economic security to consider a tax credit for the childless, which is not something anybody really talks about. Would you consider adding a category for that? Women have more flexible spending. childless people, have more flexible spending income and more social income, and that I think that's valuable. And thank you.
Absolutely. So we have a state version of the earned income tax credit that we've expanded over the years to include those who are self-employed. We definitely can look at it in terms of, based on income, what we can do for those who don't have children.
I would add that, because yes, I agree that we should not treat anyone differently. We should try to give everyone an opportunity to have a basic living. And what I will tell you is that as HHS Secretary, one of the things that we did on healthcare is we did not distinguish between a family and an adult who needed access to Medicaid or Medi-Cal, because there are a lot of adults in California and in the country who would not qualify for Medi-Cal or Medicaid services, and that's one of the reasons why we have such a high rate of uninsured. So we were able to reduce the uninsured rates by making sure those adults had access to care, even though they didn't have a family.
And I would work on affordability so that your dollar could go further. If the cost of living continues to go up 3 to 5% every year, if you get a 3% increase, you're either staying flat or you're falling behind. We have to work on affordability. We have to create pathways to home ownership. We have to lower the cost of goods, and we have to have accountability, because you are not going to have an affordable state until you have an accountable one.
Yeah, it's well said. I'm really focused on the cost side, how we bring down cost, how we build more housing, how we keep good high-paying jobs here. I do think the earned income tax credit's a powerful tool. We can look at expanding it, but we just talked about how we need revenue and resources, and so my bias is going to be toward having more of the things we need: lower cost housing, lower cost energy, and really having that abundance mindset.
Thank you. Please consider expanding your income tax credit towards singles.
Thank you. Go ahead, sir.
Kademara Yasutaganis, o tempora o boralis. That's Greek, if you guys didn't realize. I'm here as a carpenter from Redding, California, and I represent the citizens of the northern state. We're very upset. We're not happy. I'm a builder. I build homes, single-family residence. Gas is going through the roof. A 2x4 costs 3 times what it cost 2 years ago. You guys are crushing us with the Bolshevik bureaucrats and the coastal commie Confederates.
Sir, please keep it respectful.
That is respectful, ma'am.
Please get to the question.
What are you going to do to reduce the size of government and overreach? And if it comes to it, will you support the liberation of the free state of Jefferson?
Okay, well, I'll tell you no. I do not, but we have the resources that we need in the state to take care of our challenges. We just have to have the courage to be able to do things differently. But I want you to know that I hear you in terms of what you're struggling with and what your frustrations are, because the reason why I'm running for governor is because I want to know that my kids have a future in this state, and the reason why I got into this race is because that wasn't a resounding yes. There are a lot of things that need to change in this state. There are a lot of things that we have to provide access to, like the pathway to home ownership and child care and accountability, that we need to focus on. But I think we can manage the challenges by continuing to stay a part of this amazing, this country, and working together to do it. But I hear you, and I don't want you to think that I'm not listening and that I won't be focused.
We have to get to the next one, and please keep it short.
So I'll go next if you want, and I will simply say, first, I want to make it so that you as a carpenter, I was a construction worker myself. My father is a pension member of Laborers Local 185. I was a member of Laborers Local 185 here in Sacramento. I want it so that you can buy the house you build, and right now you can't. And so I want to do everything possible to build enough and keep the cost low enough so that the house you build, you can actually consider buying. Second thing I'll say is that we got to stop the man-made disasters coming from Washington, D.C. This tariff mania has helped increase the cost of lumber dramatically. And what we have to do is make sure that we work together. Moving towards some state of Jefferson would not be a way to work together. And so I would make sure that as governor, I continue to keep our state and all its people working together.
We're past time, so if you don't mind keeping it under 30 seconds.
Keep it really brief. I just say we're stronger together as one state. Definitely don't support breaking up California. I think that the way we get at what we both want is to be a state where people want to invest and build and grow. In San Jose, we capped impact fees and we started getting more housing under construction. CEQA reform, capping liability that's driving up insurance costs. We have broken the housing production market in California. Matt Mahan. Okay. I'm not breaking up the state.
All right, y'all. Thank you so much for coming out. First, a round of applause to our moderator, Daniela. Thank you so much for keeping us on time. 6 o'clock, we didn't kick you over. This might be the only legislative-led forum that we're gonna have here. So I wanna thank the candidates that actually came out, because you're gonna be working with us, the legislators, and to the candidates that bailed on us last minute, the women will remember. We'll remember that, because the women in the Senate are now 51%, and we're gonna reach parity hopefully in 2026. So the next governor will be working with the majority women-led legislature. So I want to thank you for taking the time and the importance that you are putting on the partnership with legislators. So round of applause one more time for our candidates, and thank you so much for coming, y'all. Have a great evening. Oh, if we still have members here, if you can come up, we're going to take a photo with the candidates if you are comfortable with that.
Oh, my that was a trip.